behalf of all the senators on both Human Services as well as the Select Committee on Mental Health, we welcome you to our oversight hearing today, focused on the misuse of psychotropic medication in foster care. We are honored that all of you would take time out of your busy schedules to be here today. Would like to be able to do a little bit of housekeeping before we get into today's hearing and opening statements. First of all, I'd like to be able to say thank you to the senators who are here today. Starting at my left, we have Senator Nguyen. Thank you so much for being here. Senator Hancock. We have Majority Leader Bill Monning. And we also have the chair of the Mental Health the Select Committee on Mental Health. Very excited that Jim Bell is here today. Mr. Bell is going to have to leave and chair the Transportation Committee meeting here in just a bit, but we're grateful that he would take the time. I would also like to say thank you to the panelists who've taken time out of their busy schedule. In particular, would like to be able to call out Director Lightbourne for being here today. Thank you so much, Mr. Director. And also, I want to take a moment to say thank you to the Human Services Committee staff, both Sarah and Mariva, for their amazing work on being able to get today's panel organized. And I think we need to give both these two amazing ladies a round of applause, please, for their hard work. Just a bit of housekeeping here. Each panelist is going to be given 4 minutes to be able to present. We'd like to be able to get through each of the panelists on each panel before questions, and of course, welcome any and all questions or comments from committee members. We are also going to welcome all of you, members of the public, to please comment today and offer your suggestions and questions. There is time on the agenda, and we really do want to hear from you today. Each member will be given 3 minutes to be able to talk with the committee. And again, we are so appreciative that you would take time in your busy schedules to be here today, in particular, to focus on this important topic. And my last item is I am fighting a nasty cold, and I apologize. If I cough in your ear today, I do apologize about that. And we have a lot of chocolate and cookies in the back. So please help yourself, as that is a staple of the Human Services Committee. And what I'd like to be able to do is say a few opening remarks, and then hey, there we go, and then turn it over to Senator Bell. And unfortunately, today is not the first time the legislature has held an informational hearing on the topic of psychotropic medication in foster care. As many of you know, almost a decade ago, in 2006, and many of you were in this room, we're talking about this important issue. And unfortunately, we are a decade down the road, and very little progress has been made. And some could argue California's foster care system, the largest in the nation, has grown more addicted to the use of mind-altering medications. Since 2006, rates of psych meds has continued to climb. 9% total foster care population in 2006. Fast forward to today, we're at 15%, with very little state oversight or action taken. Even more significant, we've seen a fairly dramatic decrease in the number of foster youth in the system over the past decade, and I want to thank the department for their work on this. But California's reliance on psych meds have increased even though the population has dropped. And it's simply not acceptable that 72% of the total $226 million spent out of Medi-Cal for psych drugs over the last decade were spent on foster kids. 72% of $226 million. Several other states have made significant reforms. Here in California, we've done little to act on this alarming issue since we were discussing it in 2006. And I think that we can all agree that this is a complex problem that confronts us. And I don't think anyone will argue there aren't legitimate reasons some foster youth should be prescribed psychotropic medications. But foster youth are prescribed these medications 9 times higher than other kids on Medicaid. Out of all the foster youth on psych meds, 60% are on antipsychotics, and 36% are prescribed more than one medication. And looking at these statistics, what I think that we can see is a system of care that is in dire need of significant investment and not on more pills. We need to invest on services and support that will help foster youth move past the trauma that they've experienced. And we're grateful that we have several foster youth here today. And I want to say thank you for traveling long distances to be at this important hearing. Our bottom line is this. We can't let another decade go by without creating a system of care that is capable of helping kids heal from the challenging experiences that they have lived through or protecting them from further harm. Children are in need of stable homes, yet upon entry of the foster system, 27% of kids will have 3 or more placements within the first year. For kids who have been in the foster care system more than 2 years, 60% have had more than 2 placements. 1 in 10 youth attended 3 or more schools within the first year. And it's no wonder by the time these kids reach adolescence that they're behind in school, that they have trouble bonding with their caregivers, and they have good reason, quite frankly, to be sad and angry. Often their behaviors reflect the degree of trauma that they've experienced, and all too often, wonder drugs have become the first response in this state. But we all know in this room that we must do better. In 2010, 42% of foster youth didn't graduate from high school, compared to 24% of all students. And studies have shown that an estimated 14% of inmates in California were in foster care at some point in their life, and that over half of that group lived in group homes. That same study found that 40% of foster youth were incarcerated within 5 years of leaving foster care in California. 40%. Not acceptable. And let's be clear, these are the state's kids. The state has assumed responsibility for the care of these children and removing them from their homes, and every child entering the child welfare system has experienced an upheaval in their life. And the reasons that led to this removal are extremely traumatic. I cannot imagine it. And with each change in placement, we deepen the impact. Our child welfare and mental health systems are established to focus primarily on the mental health needs of kids who have severe behaviors as a result of untreated trauma. Children's mental health services appear to be focused on services for kids and teens whose needs were never met earlier in the child's involvement with the child welfare system. The state system must include, we have to include, an in-depth assessment for signs of trauma for every child that enters the child welfare system. And it should establish a continuum of services that addresses their needs upfront and early on, rather than requiring their needs to fit into the narrow boxes of services that we've created over many decades. It's time for the state to be a better parent. And I know all of us are looking forward to hearing ideas about how to better address the needs for all kids in foster care, long before they're at risk of needing psych meds. And for those foster youth that need to be on medication, we need to ensure that these drugs are prescribed safely and that the pill does not become the primary method of treatment. We've known this practice should have evolved, and as we look back, shame on us for allowing another decade to pass by. Thousands of California foster youth have become the victims of inaction and at times politics. Again, we're grateful that you're here. I'd now like to be able to give the floor to Senator Bell.
Well, thank you, Senator McGuire, for holding our joint hearing with our select committee on mental health. And it's been a pleasure to work with you. I look forward to working together with you on these issues. I really did enjoy last year chairing this committee.
Yes, sir.
And I feel very comfortable in turning it over to a fellow senator that has all the background that you have in terms of your county experience, and I know you're going to do a great job. And I also want to echo the wonderful work our staff has done. We have great staff in this committee. This hearing is going to be very important because the use of psychotropic drugs, while they can be beneficial when prescribed appropriately, they also have some serious side effects and can be harmful, especially when used over a period of years. And long-term use of the drugs can lead to morbid obesity, diabetes, heart disease, and in extreme cases, death. And we have to learn what the reality really is. We have to understand the widespread use of these powerful drugs in the foster care system, and equally how and why they're used when we embark on a solution. Thousands of children are counting on us to do a better job. On November 19th of last year, Senator Mitchell and I submitted a detailed request to obtain information we need to understand what exactly is going on. Although we have some of our data back on that, we are hopeful and are waiting still for a lot of the information we requested. My hope is that the department will provide all the information requested in the next couple of weeks, and I hope they will answer a question about that. When will we get that information? We cannot use psychotropic drugs as a crutch to control behavior, and we must provide alternative options to services to kids who can get well without the use of drugs. And we must also better educate caregivers about potential alternatives that they may achieve the desired goal. We need to have good, solid information from the departments, and we also need to set up an alert system to notify us of potential abuse. And we've been working together as a group of legislators concerned about this, and we have worked with the stakeholders as well. And together we have come up with a packet of legislation that I believe will help the state do a better job ensuring kids are safe. And nearly 1 in 4 children in foster care and 56% of the children in group homes are receiving these powerful drugs, often without adequate oversight. I will be carrying 2 bills this year. The first bill calls for public health nurses to oversee the medical monitoring of children's medications. This can be financed with a 75% federal match, so it can be done, it's feasible to do. And I'm also carrying a bill that will establish treatment protocols and oversight in group homes to reduce the over-reliance of drugs to control California's most traumatized children. Finally, I'm co-author with Senator Mitchell in her bill to mandate the ongoing collection and review of the data that we requested and to ensure the safety of our kids. I'm sorry, I have a chair of another committee going on at the present time, and I will stay for the hearing, but my staff is here, and they will make sure I'm fully briefed on what's transpiring. I'm going to go upstairs now to my other hearing, but I'll be back. Thank you very much.
Thank you.
Thank you.
No, thank you so much, Senator. And I do want to say thank you to the Senator for his incredible advocacy, both as previous chair of Human Services Committee as well as the chair of the Select Committee as well. Thank you so much, sir, and I know you're very busy. Would like to be able to look to the other senators if they have any opening remarks that they'd like to be able to provide or any comments thus far. Again, I want to say thank you to the 3 of them for being here at your busy schedules. So without further ado, ladies and gentlemen, if it works for everyone, I'd like to be able to move on to our first panel. Our first panel will introduce the issue of psychotropic medication in foster care. They're going to present the data as we have it, provide an overview of the challenges the state has faced in addressing the problem, and point us towards needed reforms to better meet the needs of foster youth who receive medication, as well as all children in care. At this time, I'd like to be able to call up Ms. Johnson, Mr. Stewart, Ms. Rodriguez, and Ms. Huffman to be able to come forward and join us to the front. Anna Johnson is a policy analyst from the National Center for Youth Law, and Ms. Johnson's going to kick us off, and then I'll invite Mr. Stewart after Ms. Johnson's 4 minutes. And again, we want to say thank you to the 4 of you for being here today. Ms. Johnson, the floor is yours.
I'll use this one. Okay. Thank you, Chairman and members of the committees, for holding this much-needed hearing today. I'm here to speak on behalf of the National Center for Youth Law about psychotropic medication misuse with foster children and what we can do to ensure safe care for each child. I look forward to the discussion around what we should be doing for the health and well-being of all children in our care. Today, I just want to emphasize we're not here to debate whether or not psychotropic medications are misused. We know that too often foster children are misdiagnosed and overserved pills at adult dosages that can cause short and long-term disabilities, pills that can change their lives forever. We've been alerted to the misuse of psychotropic medications by governmental and media investigations, by lawsuits against state systems who neglected to care for children, children who met an early death, who have developed chronic diseases, experienced organ failure, boys who develop breasts. We've seen children with rapid weight gain leading to the development of obesity and diabetes, children with irreversible tics and tremors, and these are known side effects of the medications. I think both of the senators, McGuire and Bell, named some of these and how serious these risks are. And I know we have panelists today that are going to speak about those very real effects. We've also been alerted to these issues by the string of billions of dollars worth against drug companies for tampering with this research and illegally marketing pills for use in children. We were alerted by federal guidance and hearings and by our own foster children, caregivers, and professionals about how serious this issue has impacted them. Despite all of the alerts we've heard, we still need this hearing today. We've never had the combination of legislative, administrative, and agency leadership aligned to address this issue comprehensively. And I think by the opening remarks today, we've heard that we want a comprehensive approach. We've heard a range of the issues. And so I'm really happy that this isn't going to be a siloed discussion. As a policy analyst and advocate, I believe we do have the possibility to raise our actions to the level of alert that is necessary to treat children. Federal hearings, reports, conferences, and guidance letters issued to the states yearly since 2006 have described the issue in detail and the charge of the states in protecting foster children. The GAO reports detail that children are prescribed too much medication, too many at the same time, too soon at very young ages, and for too long beyond the periods of time that these medications have been studied, even in adults. Despite this evidence and the lack of the evidence for the medication's safety in children and repeated guidance from the American Academy of Child and Adolescent Psychiatrists, the American Diabetes Association, on the use of these medications, states have still failed to provide safe standards, and I think Senator McGuire really detailed that. The reports tell us that caregivers are unprepared to deal with the behavioral problems that are developmentally, or behavioral reactions that children show that are actually developmentally appropriate. They're natural reactions to grief, trauma, and suffering. And these children and caregivers have even less training and resources on what's needed to safely administer and watch for side effects of psychotropic medications, but also resources to access what they do find healing and what they do find healthy. Federal agencies and the President of the United States have stated that failure to employ therapeutic treatments in lieu of or in conjunction with psychotropic medications is not acceptable and must be addressed in every state. Finally, states were told they're not doing enough to oversee and monitor the use of powerful drugs with foster children. I've been involved in our state's process, the Quality Improvement Project, since the beginning, which is our state's response to that federal guidance and alerts. In 2012, the state agencies created the Quality Improvement Project to address those concerns. 3 years later, we still do not know how many children in California are prescribed medications, for what purpose, with what other therapeutic interventions in place. While other states are conducting quarterly or monthly reports on this issue and taking action, ours is yet to release a baseline. Our state guidelines for safer prescribing and red flags to identify children at risk of dangerous side effects are still awaiting approval a decade after other states have issued their guidance. We don't have to wait. Senators, you can act now to align the resources and ensure that appropriate standards of medical care are applied to the administration of psychotropic medications on children in foster care. And more importantly, you can prioritize the appropriate treatments that serve the health and well-being of children in foster care. Thank you so much for this hearing.
We're very grateful that you're here. Thank you so much. And Senators, if it works, what we'll do is we'll hold questions until the end. And really appreciate you being here, Ms. Johnson. Thank you so much. It is now my pleasure to be able to introduce Dr. George Stewart, a consulting child and adolescent psychiatrist with Seneca Family of Agencies. Thank you so much for being here. 4 minutes. Please.
Thank you, Senator. I'm very pleased to be invited and appreciate the opportunity to make some points. I wanted to make 3 points and then elaborate on them in my talk. The first is that the research base for the safety and efficacy of psychotropic medication use in children is inadequate. The second point is that child psychiatrists and pediatricians are put in untenable positions in their work with traumatized youth, leading to the overprescription of medications. And the third point is that traumatized children are healed through supportive, loving relationships. Medications merely suppress symptoms. The research base supporting the use of psychopharmaceuticals in children is both thin and corrupted. I wish I had something for your cough, but I'm a psychiatrist. You can tell me how it feels. Most medications are prescribed off-label, that is, for uses in children that have not been approved by the FDA. The psychopharmaceutical industry is immense. $320 billion worldwide in 2013, and growing that year at 17% per year. More is spent on marketing than on research and development. The research process, called the trial system, clinical trials, is broken according to prominent scholars. Conflicts of interest abound, with drug companies funding their own studies and reimbursing the physicians who are conducting the studies. Study results unfavorable to a drug are buried, and there are no long-term studies of the effects of these medications on the developing brain of children. Point 2, foster children have been multiply traumatized, including living in violent and chaotic environments, suffering sexual and physical abuse, witnessing domestic violence, enduring homelessness, and so forth. They are often fearful and reactive. They often use violence toward themselves, towards others, or toward the environment as an adaptive strategy. Child psychiatrists and pediatricians, for pediatricians, prescribe about a third of the psychotropics to children, to foster children, are asked to help with the foster child's symptoms and behaviors, often in times of crisis. The resources to be definitively helpful are often not available, so they prescribe a medication. The actions of the medications are very nonspecific. So I was trying to think of a metaphor. It's a little like doing vascular surgery with sharpened sticks. If the medication only helps a bit, then often another is added, and so forth, as the child accumulates side effects from multiple medications. I have commonly seen children, especially discharged from an acute hospital stay, taking 3 to 5 medications. I've seen one child who was taking 8 medications simultaneously. There are no studies of using 3 or more medications simultaneously in children, and very few of 2. So how can we respond? In addition to developing guidelines for the prescription and monitoring of these medications in children, as is being developed by the QIP, and strengthening the JV220 process, which is also underway, we need to provide these children with the resources that will help them heal. Medications at best only temporarily suppress symptoms. They do not cure, as does penicillin with pneumonia or strep throat. And I think this is a misconception that parents have and that many people have who aren't as close to it. What can heal traumatized youth are loving, supportive relationships in conditions of safety that endure over time. And I think all of those are important to consider, including endure over time. These require considerable support and a full continuum of services, especially crisis services, which is often when children are more heavily medicated, tailored to their needs. Our most vulnerable and discarded children deserve our best. Thank you.
Very grateful for your thoughts and for your dedication to foster youth as well. Thank you so much for being here. It is now my pleasure to be able to introduce Jennifer Rodriguez. She is the Executive Director of the Youth Law Center. And Ms. Rodriguez, the floor is yours, and thank you so much for being here.
Thank you, members. So I'm one of the old timers who was here 10 years ago, testifying in front of the legislature at the informational hearing on this very topic. At the time, there was a cry to action after this issue had been raised repeatedly by young people who were in foster care, who were grappling with the effects of these life-altering drugs, and also by media coverage that highlighted the dangerous combinations that we heard about and how little regulation there was. At that time, I was representing the California Youth Connection, and my testimony was about the personal impacts that these drugs had had on my own health, on my own coping mechanisms. And I brought with me dozens of CYC members who testified to members about conditions such as heart murmurs, about rapid weight gain, about fertility problems as adults, and about the emotional side effects that ended up being worse than the underlying original condition that prompted the use of medication. Today, I'm testifying as a lawyer and the executive director of the Youth Law Center, and while that piece has changed, the underlying policy issues that drive our system to medicate youth, they haven't changed, not yet. So I'm hopeful that what has changed is the receptiveness to treat this issue as urgent and to provide this next generation of children and youth the family support and those loving, supportive relationships, and most importantly, parenting, that's necessary to protect against the inappropriate prescription of and over-reliance on psychotropic medications. No matter how much regulation and protection is put in place, the elephant in the room is that psychiatrists, social workers, courts, lawyers, and mental health clinicians heavily rely on caregivers to be the consistent, knowledgeable, reliable historian for what the child has experienced, for the symptoms that they have, for how those symptoms fit in the context of their environment, and if psych meds are prescribed, to communicate how the youth react, whether their symptoms improve or worsen, and to closely monitor the effects and the side effects to protect youth from serious harm. What we also know is that more than half of the youth who are living in California's residential group homes, and the rate is about sort of 40% of all of the youth who are prescribed meds, are living in environments where their caregivers are none of those things. They are cared for by minimum wage staff who are untrained, they are inexperienced, they work 8-hour shifts typically, they turn over more than anybody turns over in our entire system. These young people who are in those facilities, they are not parented. They do not have loving, caring, consistent relationships with caregivers. They do not have anybody who is knowledgeable, who is stable, or who is reliable as the custodian of their history. This, in my opinion, is the biggest systemic factor that's influencing our over-reliance and inappropriate use of psychotropic medications. We hear from attorneys, social workers, probation officers that caregivers demand that young people be put on psychotropic medications in order to keep placements, in order to deal with behaviors. Over the last 2 years, we have been working with a group of international researchers who look at developmental science, and they have come up with a consensus statement, and in fact, research is telling us a much more damaging story about what we're doing to young people related to group care. This statement has just been published. It's called the Consensus Statement on Group Care for Children and Adolescents, a statement of policy by the American Orthopsychiatric Association. And I will tell you this statement because I think it's powerful. And that's that every child has a basic right and need to grow up in a safe home with a stable, continuous relationship with at least one adult who is a trusted, committed parent figure. Group settings should not be used as living arrangements because of their inherently detrimental effect on the healthy development of children, regardless of age. This is the issue that's underlying our use of psychotropic medications. By their nature, congregate care facilities are difficult to operate and even more difficult for youth to heal and to grow up in. What ends up happening is that we respond not to organic issues, but to the environment, the loneliness, the defiance, and the behavioral environments that that very environment creates. In fact, in looking at research on congregate care facilities that care for very different populations, the elderly and developmentally disabled folks, we see that the rates of psychotropic medication use, they're almost identical. They're markedly similar. The conditions are similar, even though the populations are different, and they consider in those facilities the high rates to be a failure of treatment. There are several factors that influence the conditions in congregate care and the push to psychotropic medication. There's the grouping of young people, all of whom are struggling with similar issues, all of whom have a history of trauma, abuse, and neglect, who all learn behaviors, coping mechanisms, and do what teenagers do, which is be influenced by peer behavior. There is a lack of facility ability to individualize the mental health care that youth so desperately need. Young people are not parented. There is limited access to activities and alternatives, and we see the problems and conditions continue to arise. What we know is that effective treatment and interventions do not require and are in fact inconsistent with group care. It's wasteful. We are spending huge amounts of money on the wrong thing when we could be getting equal or better results for a fraction of the cost. What we do know works are things like therapeutic foster care, wraparound services. In one of our counties that has the highest rate of group care in California, Sonoma County, we have actually seen them reduce by half the amount of young people who are in group care over the past year and a half or so. And the way they have done that is by moving children into families with wraparound services. And talking to one of the wrap providers, they told me that their services are more for the family than they are for the youth. 2 hours of therapy for the family for every 1 hour that they're doing with the young people. We will see our statistics continue to reflect this over-reliance and inappropriate use of psych medications until we really prioritize moving children out of congregate care facilities and into settings and families where they can get that parenting and where parents, relative caregivers, and foster parents get the support and services necessary to care for these children. That will take a partnership between child welfare and mental health to see that partnership fully materialized. We are very encouraged and excited about the continuum of care efforts that are being prioritized by CDSS and fully support those efforts. We are hoping that the legislature follows closely behind and also prioritizes those efforts, and we feel that those are really key to seeing things change for young people who are prescribed psychotropic medications. Thank you.